Have you gone to the doctor and told them all your symptoms and they have come back to you with labs that say that nothing is wrong, everything is normal? Well, while this is very true that maybe things are normal on labs, maybe things aren't optimized. And medical doctors are not in the wrong in saying nothing is wrong with your labs. They are normal compared to the average American. But we all know that the average American is overweight, sick, and tired. And simply to be in optimal range is not what their focus is on those labs. Their labs are to detect any type of pathology that is present. So they are looking for big changes in labs that lead to pathological disease. And those are the ranges that those labs are based off of. As a naturopathic doctor, my goal is to optimize the health of my patients. And by doing so, I compare labs to optimal ranges. And different labs have all different types of optimal ranges. And today I want to try to focus on a few 6 common labs that are really important for overall health. And getting these to optimal range is important, especially if you live here in the Midwest and Wisconsin, where we don't get a lot of sunlight. Vitamin D is very important. And if you compare the conventional range, it's 32 to 100. The optimal range for vitamin D is right around 60 to 100. And this is so important for preventative of cancer, preventative of bone health, fatigue. Autoimmune patients do really well with higher levels of vitamin D. And so when I see a vitamin D level that's at 30, I try to boost that up to 80. 60 to 80 is usually my goal. There are risks to supplementing with vitamin D, and it's a fat soluble vitamin. So you don't want to oversaturate your levels of vitamin D. It can be toxic. You can have abdominal pain, severe toxicity symptoms. So I like to monitor my patients' vitamin D. And if you are supplementing at home, make sure you check it at least once a year. And if you're supplementing a high dose of vitamin D, every 6 months is ideal. Of course, talk with your doctor on your schedule when you should test it, but it should be something you adequately check, especially right before periods of no sunlight during the winter time. The next common lab is thyroid hormone. So commonly, your medical doctor at your annual visit is going to run a TSH. And while it is so important to run the TSH, the thyroid stimulating hormone, this is the hormone that stimulates the thyroid gland to produce adequate levels of free T3 and free T4. These are the hormones that actually do the work in creating all of the different metabolic processes that the thyroid gland does, especially free T3. That's the most important. But often they only run the TSH. And if the TSH is normal, then they don't run the other labs. It doesn't reflex to those other labs that I was just talking about. So a conventional range, a TSH runs from 0.4 to about 4.5. Sometimes you'll see it even go higher. Optimally, though, you shouldn't have too high of a signal going from the brain to the thyroid gland. You should have it around 1 to 2. You want a good signal, but not super high, because if it's too high, then your body senses that there's not enough thyroid hormone. And if too low, there's too much thyroid hormone. Free T3, there is an optimal range for free T3. Because of this is the active thyroid hormone, we like to see this around 3 to 4. That's a good range. If it is below 3, a lot of people will present with fatigue, lots of fatigue with low free T3. With free T4, oftentimes I like to see it right around 1 to 1.5. Sometimes this can be normal range, but if it isn't in normal range, if it's a little bit higher, then that's typically associated with inoptimal conversion of T4 to T3. So we need to supplement with more cofactors to help that person create more thyroid hormone free T3, especially if the free T3 was low, the B12 level. This is the one that is the most shocking for me to see low on a person's labs, because their medical doctor will say, well, it's in conventional, it's in the range, it's normal, it's 200. Well, the range is 200 to 800 on most labs. And most people, if it's below 400, they're going to feel brain fog, memory problems, difficulty thinking. And so when I see it below 400, that is a sign that you need to be taking a B12. There's something with the diet, then that's a reason to supplement with B12, or just increase more B12 foods like nutritional yeast, etc. And then if B12 is high, but it's you still have those symptoms of brain fog, fatigue, difficulty thinking, etc., then you might want to check a level called methylmalonic acid, MMA. This is a very sensitive test that will reveal a true B12 deficiency, especially if your levels are normal. So ask your doctor to order that if you do have those symptoms and you're still presenting with a normal B12 level. In addition to a B12 level is a ferritin level. Ferritin is the storage form of iron. So typically when I see someone who is fatigued, they have lots of easy bruising, symptoms of iron deficiency anemia, but their iron level was normal, I want to see a ferritin because the ferritin is a storage form of iron. Too much iron in the body presents as inflammation. So this can be present in different autoimmune conditions. We want to see ferritin right around 40 to 50 in a good optimal range, sometimes even close to 80. Conventional range, ferritin can be anywhere from 11 to 200. One of the other labs that I like to run is a fasting blood sugar. So conventionally, blood sugar should be below 100. The range is 65 to 99. And if you have blood sugar fasting, 12 hours fasting at 99, your doctor says you're good, there's no diabetes, no worries there. But what I like to see is good blood glucose control. So I don't like to see a blood glucose higher than 90 typically. I like to see it right around 80 to 90 so that there's good blood glucose control because we don't want to eventually produce insulin resistance. A lot of people who feel tired after meals, especially after lunch, if you feel really, really tired and fatigued after lunch, and this could be a sign of insulin resistance or blood sugar irregularities, where you're having high ups and downs with your blood sugar and there's not good blood sugar control. So make sure you're getting protein and fat in those meals to help stabilize your blood sugar, but then also cross-check your fasting blood glucose with your hemoglobin A1C. Your hemoglobin A1C is an average of your blood glucose or your blood sugar over the course of 3 months. It gives me a good picture of what your level was. The conventional range is right around 4.5 to 6. But optimally, you really want to be right around 4.5 to 5. You don't want to be in that pre-diabetic range, especially if you are at risk of prediabetes. You want to make sure that that is less than 5. Insulin regulates our blood sugar too, so we can always cross-check these things with a fasting insulin. And that's something that isn't always run. It is important to run this. You want to see a low insulin level if you're fasting because insulin regulates blood sugar and it's only released when there is high blood sugar. So if you're fasting and you have a high insulin level, then there is an issue with blood sugar and maybe insulin resistance, potentially putting you at risk for PCOS, obesity, hypertension, heart disease, etc. Ideally, you want it below 3. The conventional range is right below 5. The last one I would say is a lipid panel. So a conventional lipid panel, let me just pull up one over here that I have with me. They're going to show you different ranges for cholesterol, triglycerides, HDL, cholesterol to HDL ratio, and then LDL. Standard ranges, like I said, are much more broad in spectrum, as you've kind of seen throughout this video. And the emphasis on HDL, or that healthy fat, that high density lipoproteins, we want to see those around 60 to 80. We want to see a good level of HDL. And then for LDL, we like to see that below 100. The cholesterol to HDL ratio, we like to see that less than 3. The range is 2.9 to 4.3. With all of the heart disease in this country, it's no shocker that this range is that high. We need this ratio to be good because we need enough healthy fats to balance out that cholesterol. And if you have a lower ratio of cholesterol to HDL, then it's a good sign that you're in a good place for heart health. There's different ranges here that I'm bringing up. And of course, always check with your doctor about your specific labs. You're going to have your own situation that's going to change the different variables that I've been mentioning. Certainly for someone who is struggling with fatigue, I'm going to make sure that their B12 is optimized, their ferritin, their thyroid. I want to make sure all these things are optimal before I start to do anything else with their health. I think that's something that gets lacked often in conventional labs, is that we don't try to optimize people's health and get them to a good place. We just try to make sure there's no disease present. And in order to prevent disease, we need to make sure optimal health is maintained. So if you like this video, go ahead and give me a like below. Otherwise, follow me for more tips and tricks in health and wellness. Thanks. Bye.